Everybody's busy. Our
This
life
meeting
is
is being
busy.
recorded.
So I really appreciate everybody's here. My name is Viviane Rinaldi. I'm a community health educator at the West Hartford-Bloomfield Health District. We're doing a lot of outreach right now. So if you would you like to partner with us, if you would you like some training, don't feel free to reach out. I'll be happy to show what the options we have, how we could partnership, how we could offer programs to our community and share important information like the information we're going to share today. So I'm going to pass the moment for Melissa. She's going to introduce herself and she will start the presentation. Thank you so much.
Thank you, Viviane, and thank you, Mara, for inviting us out tonight. Actually kind of glad that we're doing it virtually because of this thunderstorm that we're having. So it's kind of helpful. I will just sort of caveat this with saying that because there is a storm nearby, I have lost power at my house the last 2 days with storms. So I'm hoping that this is just a quick little storm that's not going to be impactful. If I do lose connection, Viviane has my slides. I will just dial back in, and Viviane will share the screen for me. But I'm hopeful that it will be fine. So my name's Melissa Marquis. I'm a nurse, and I am the public health emergency response specialist for West Hartford-Bloomfield Health District, as well as the Farmington Valley Health District. And my main job is to manage and oversee our public health preparedness program. So before I get into everything, I'd like to just remind folks, if you're not speaking, please mute your phones or your computers because we're getting a little bit of feedback currently. And so we want the recording to be nice and clear. All right, so let me go ahead and minimize that and advance the slides here. Okay, so for our objectives, I'm going to quickly go through a lot of different topics regarding public health preparedness. So I apologize if I speak a little bit faster. It's just there's a lot of material to cover in an hour. And I want to be able to leave a little bit of time for questions at the end. So we'll give you a quick little rundown on the landscape of public health in Connecticut. What does it look like? We're going to review the principal concepts of what public health preparedness is. And we'll talk a little bit about different roles and responsibilities in public health emergencies. And then we'll talk about the importance of being prepared personally on having an individual level of preparedness. So from the standpoint in Connecticut, every Connecticut resident is served by one of 60 different local health departments. And you'll see these all on this screen, and it's a lot of blues. The blues represent the local health districts. Health districts are comprised of anywhere from 2 to 19 towns that a health district is covering or providing services to. So there are 20 different health districts throughout the state. The other 34 health departments are municipal departments. So those cover just a single town or municipality. And then additionally, there are 6 part-time municipal departments. Those are typically found in the much more smaller or rural communities scattered throughout the state. So with the full-time health departments, including the health districts, that covers approximately 98% of the population in the state. And then there's additionally, you'll see those 2 little red dots over in Eastern Connecticut. Those are our tribal local health departments. And so when we focus in on Bloomfield specifically, hopefully you were able to identify when I said, and when Viviane said we're with the West Hartford-Bloomfield Health District, we cover both towns of West Hartford and Bloomfield. So we are the local health department for Bloomfield, and again, as well as West Hartford. So combined, we've got an approximate population of about 84,000, 84,000 people. And so you might be wondering, well, what do we do within the community, and specifically within our 2 communities? So we work, not only us as our department, but all the health departments within the state work collaboratively with many town-wide and statewide departments, including police, fire, EMS, emergency medical services, hospitals, local emergency management, long-term care facilities, social services, libraries, other health departments, and a whole host of additional, whether it's non-governmental or faith-based organizations. And so most of the time, our work is not noticed, or it's a little bit under the radar, that it's not something that most people typically either think about or know about unless they work in the industry or in the field. And so oftentimes we're not recognized until there's something wrong, whether it be a foodborne outbreak at a restaurant, or some big septic system concerns within a residential community, or in emergencies like public health emergencies, like COVID or other infectious disease outbreaks. So it's usually when those services are disrupted is when the activities and the roles that we have within the community are really sort of highlighted and recognized. And so this slide hopefully just helps to show that really we are prevention focused, we are promotion focused, and protection focused. And we really highlight those areas, sort of those basic tenets of public health to prevent illness and outbreaks, premature death. We want to promote policies and practices that support good health practices within our communities and good health outcomes in our communities. And then again, preventing and protecting against emergencies and infectious disease outbreaks. So getting into a little bit more on the preparedness side, what types of emergencies does public health have? And really what we like to say within our health department and across the departments in the state is that we should be considered as a first responder, like fire, like police or EMS, except we don't have the lights and sirens. But in any case where there's the potential for harm to the public or potential concerns to the public's health, we have a role. And so from a preparedness standpoint, that might look like terrorism, other sources of intentional emergencies, chemical, biological, explosive attacks, anything that's, where somebody's intentionally choosing to harm individuals, and usually a group of individuals. And then we may have man-made events, some maybe like a mass casualty type of an event where there may be a local but large-scale emergency, whether maybe think of maybe a bus crash with numerous individuals on a bus. It could be, oh gosh, there's just so many different things that could be caused by a man-made event that could cause a mass casualty event. And public health does have somewhat of a specific role in helping to manage or alleviate those concerns. And the last one would be anything naturally occurring. So this is probably the bigger category that we plan and prepare for. So things like severe weather, earthquakes, floods, tsunamis, typically those don't impact us much, but we do still need to be concerned, especially on the earthquake and the flood side, that can certainly impact us. But generally, most of our planning is honed in on the emerging infectious diseases, pandemics, other communicable disease events, and then other mass casualty incidents, such as maybe a plane crash or train crash, other large scale emergencies, maybe you see a picture of the Boston Marathon bombing on this screen. Perhaps there was a mass casualty event at the Hartford Marathon or something to that effect. So those are all different things that we plan for. And in terms of planning, really it's about thinking through all the worst case scenarios that could happen and putting plans in place prior to that ever happening. So things like, what are our specific roles and responsibilities, and how are we going to manage that incident from a public health perspective, and how do we interact and integrate with all of those other partners that I mentioned, a slide or two ago. And how do they know that what our roles and responsibilities are in an emergency and vice versa? So a lot of it is communication, sharing information with our partners, making sure that we know what our key roles and responsibilities are in each other's respective plans. So really being prepared is an integral part of being responsible, both from a professional standpoint as well as a personal standpoint. And so when we talk about infectious diseases and pandemics specifically, I wanted to explain the difference between what an epidemic is and what a pandemic is. Now, granted, we've been living the last 3+ years in a pandemic, so hopefully you have a decent understanding about what it is, but I did want to just quickly highlight some of the key differences. So if you think back, you may have heard, in 2014, 2015, and then again earlier last year, 2022 to 23, in different locations in Africa, there were Ebola outbreaks. Ebola is a viral hemorrhagic fever virus, and it causes severe illness, and in severe cases, it can cause death. It is highly contagious with direct contact with an individual who is sick or a deceased person who was sick. So you really have to be close contact with those people. In Africa, a lot of the burial practices in caring for individuals who are sick, their practices, they don't have the infrastructure that we do here in America. They don't have the healthcare system support that we do here in America. And so they tend to not have as many resources and personal protective equipment available to them if one of these outbreaks occurred. And so what could have been isolated in small number of cases or small clusters of cases pretty rapidly expanded, and disease was able to be transmitted among communities and then spread as people traveled from one community to another, or then one region or state to another, or another country. And so that travel is what fuels a lot of these epidemics, which then may have the potential to turn into a pandemic. And so we really want to try to minimize that community spread as best as possible. So that's one of our key tools in any any infectious disease outbreak that we're concerned about. And so the difference between the epidemic and a pandemic is really the pandemic is that global spread around the world that has the potential to affect hundreds of thousands or millions of people across numerous countries. And it has to be a novel virus, something that we haven't seen before, and that people don't have any sort of innate immunity to. So if you look at the two examples on the screen here of a pandemic, so we have H1N1 that occurred, so that was also known as swine flu in 2009, 2010. While influenza is a normally naturally occurring virus, the strains may change, and often do change year to year, and in some cases, even within the same season. You might have, we call it genetic shift or drift. So changes or mutations in that virus that cause maybe an increase in severity of the virus, or it could cause increase in transmissibility. So the ability for it to be spread person to person might increase. And those changes could spark a widespread outbreak. So while we're speaking a little bit of COVID here, just give you a quick update. We are not done with COVID. The public health emergency declaration ended back in May. You'll probably recall that. And we're not really considering COVID a pandemic any longer, but it's not gone. It's going to be around for probably years to come, or maybe indefinitely. We don't know. But illness is still very much present. And if you've been paying attention and watching the news or hearing about people getting sick, cases are back on the rise again. And so that was to be expected. We were anticipating this to happen. And so as of today, the global infections, there's a typo on the screen, and these are confirmed cases, are well over 695 million cases globally, with over 6 million deaths. In Connecticut, after the pandemic declaration was ended, the state health department stopped reporting on daily case numbers or even weekly case numbers. And so in October, they're transitioning to how they normally report on respiratory illnesses, whether it's influenza or another influenza-like illness. COVID would be classified under that. And so there's going to be some new reporting on how the number of cases and hospitalizations and deaths occur and in what age groups. So that reporting is going to start back up, I believe, in October. So currently I don't have updated numbers for how many people have been infected or have died, but since this new increase in cases in the last month or two, we have seen 184 new hospital admissions and just under 20 deaths being reported. So just keep that in mind, especially now that we're getting into cold weather season. This is the time for new respiratory outbreaks to be occurring, particularly in schools, universities, colleges, locations that a lot of people are congregating. So congregate living facilities, nursing homes, those types of facilities. So we just really need to make sure that you are doing your hand washing, you're protecting yourself and others. If you're sick or if you've been around somebody who's sick, maybe stay home for a day. Make sure that you're feeling well enough to be able to get back out into the community. Because if you're sick, chances are you're going to be able to spread it to somebody else. And we want to be able to be mindful and protective of not only our own health, but others around us. So this we already basically talked about. I'm not going to go over that and belabor it. But I sort of alluded to using some different tools that we have available to us for pandemics, particularly. You'll remember back in the very early months of COVID that they instituted lots of different closures, public closures, schools closed down, businesses closed or altered their business practices and hours of operation. A lot of people worked at home or remotely. They instituted mandatory face coverings. So there's all of these different measures that were taken place. And most of them at the time that it started were mandatory in Connecticut. Others were highly recommended or strongly encouraged. So it really is up to the state to dictate what and how they want to proceed with, layering or implementing some of these measures. But really, it comes down to measures that we can implement at a community-wide level that will reduce the amount of community transmission of a virus. And again, so those would be those community mitigations, such as, again, staying home if you're sick. So you want to isolate yourself from other healthy people so that they don't become sick with your illness. You also want to be able to stay away from other people who are sick. And so if you've been exposed to somebody who is sick, then we would encourage you to quarantine yourself for the duration of whatever that incubation period might look like for that particular virus. And they're all different. For COVID, it's 14 days. And so you may recall early on, we were asking people to isolate at home if they were sick for 10 days. And for those that were quarantined, who are watching for symptoms to develop, to stay home for 14 days. Those time periods never did change during the pandemic. We just had to alter how we wanted to allow or encourage people to reintegrate back into community events if they had been either exposed or ill with COVID, just due to the long duration of the event. The other most important tool in our toolbox relative to pandemics and viruses particularly is vaccination. Pandemic vaccines, because they're new viruses that have never been around, chances are there will not have been a specific vaccine for that very specific strain of virus. And so it takes time to develop, to identify what proteins and what, strains they need to come up with to create a vaccine. And once they have enough vaccine, they have to do safety trials. And they have to enroll a lot of people over a specific set of time. Usually it takes about 4 to 6 months after the pandemic started to really have a decent sense on whether or not a vaccine, if there's any vaccine candidates. And then once there are, like I said, once those efficacy studies have been done, they can begin to mass produce the vaccine. So it really could take anywhere up to a year or even longer to have vaccinations available for pandemics. So that's why those community mitigation measures at the community level are so important, because if they're done correctly and if they are adhered to throughout the duration of the pandemic, they really can impact and reduce the potential for community exposure or illness transmission. So those are very important concepts, and I hope that you guys have a better understanding now as to why we were so strict at the beginning of COVID. Now, things change, viruses change and mutate all the time, and so some of these elements might not have worked as well. But if a chain is broken in a link, if you think of these as links, if any one of these links are broken, then there's an opportunity for transmission to occur within that community. And so it's important to consider that. The other piece to consider and plan for is if you did have to isolate for a period of time or stay at home for a period of time, if you were in quarantine, you need to make sure that you have enough food and water for yourself and for your family for at least 2 weeks at home. Or if you don't have it, do you have the ability to get it without leaving the house? So do you have people that can either go to the grocery store and drop it off for you on your doorstep, or can you use Instacart or some other grocery delivery service? Could you do virtual doctor's appointments so that you didn't have to go into a doctor's office or an urgent care facility? Do you have enough personal medications to last you, again, for those 2 weeks or longer, so that you are not having to go to the pharmacy and potentially expose other people to a virus or to an illness that you may have been sick with? And then any other personal items to last for that recommended period of time. All right, so I'm going to switch gears from pandemics and talk a bit about severe weather. And I'm going to give you a little hurricane update for you, a little tropical weather update. So since we are midway through the hurricane season this year, you may have heard earlier at the start of the season that researchers and forecasters were concerned that this was going to be a very active and above normal hurricane season. And that was due to a number of reasons, one of which was an underwater volcano that erupted in, I believe it was Tonga, last year sometime. That active volcano erupted so much lava and so much heat emanated from that volcanic eruption that it actually affected the water's temperature across the globe. And so that, plus we're in, I believe it's called an El Nino pattern to our weather cycle right now. So those two factors, and probably a whole host of other meteorology factors that I am not smart enough to know about, have all impacted our hurricane season this year. And so they're predicting 18 named storms, including 8 major storms. Now, major means anything over a category 3. And if you're not familiar with hurricanes, there are 5 categories to the storms. So you would start off with like a tropical depression, then a tropical storm, and then it would escalate to category 1 through category 5 hurricanes. And those are dictated by the wind speed and the size, the overall size and structure of the hurricane. Currently, we have had at least 12 named storms, and we're not even quite at the halfway mark. And we've had 4 major storms. And so, again, we're not even done or halfway through our hurricane season, and we are well surpassing where we should be, even in a well, actually, I should say we're probably at the point right now where we normally would be in a what's sort of considered a normal season for hurricanes. So the hurricane season goes through November, and so we still have 2 full months, 2.5 months really, until hurricane season's over. So we're nowhere near done. That said, there are 2 hurricanes active in the Caribbean currently, Lee, and I think the other one's name is Margot. We've been particularly concerned with Lee over the last several days. I received a state update from our state meteorologist last week, providing us some of these updates that I just shared, as well as updates on the storm. And so, every day there's always changes to the hurricane based on weather patterns and, whether or not the hurricane is impacting any land or any other disruptions that may occur to the actual air structure, I guess, around the hurricane. And so currently, Lee, I haven't had a chance to look at the weather this evening. However, just at a quick glance, it appears that Hurricane Lee is back up to a Category 3 hurricane strength. It started as a 1, went up to a 5, so it's been kind of going up and down, goes through these periods of intense, increased intensivity. Sorry, I'm having a hard time saying that word at the moment. It's basically gaining strength and weakening rapidly, repeatedly. And that can sometimes happen with hurricanes. Currently, as I said, it's Category 3, and it is about to start making a northern turn. And as it makes that northerly turn, it's going to start to enter some cooler water. So it will start to decrease in intensity. However, there's multiple models that are looking at where the hurricane is projected to go in the next several days. All of the models take it up beyond Connecticut, beyond like the East Coast of New England, and going up towards Canada. Some of those models do have it hugging the Connecticut, Rhode Island coast a little bit closer. Others have it a little further east and not impacting land at all. It's looking like it may come up towards somewhere between Friday and Sunday. Depends on how much speed it picks up between now and then. And so what we're really just encouraging people is, not so much to pay attention to the strength or, necessarily the track. While the track is important, if it comes within 150 miles of Connecticut, it's a large storm. We will feel impacts from this storm. It's just a matter of how close to Connecticut it is as it passes by us. We're not going to get a direct hit from it unless something major changes, which I don't anticipate based on what I'm hearing. But we want to prepare in advance for the potential power outages. You've obviously known that we've had a lot of really wet weather this summer, and particularly as of late. So that means that the ground is very saturated right now. So it's not going to take much for even, slower winds to knock over trees, knock over power lines, cause power outages. If it were to come closer to Connecticut, obviously that increases our risk or our chances of having more significant power outages, which then would likely mean a longer duration of power outage. And so the things that we want to always have people prepare for is to have flashlights on hand with fresh spare batteries. We want to have you consider candles or with matches or a lighter. Just keeping in mind, never leave an unattended candle burning. Also, very important, if you are going to use either Propane or gas grills, never, ever, ever bring them inside or cook with them in an enclosed area, because that's due to the risk for carbon monoxide exposure. Same goes with using a generator. Always have to use it outside, away from your garage or any windows. So you've got to keep it far enough away from your house so that carbon monoxide doesn't seep its way into the home. Carbon monoxide is an odorless, colorless gas, and so you will not know until you are really highly have high levels of carbon monoxide. And typically that looks like severe headache, feeling very tired, sluggish, dizzy. Some people get nauseous, and then you pass out, and then you can die. And so oftentimes when people feel like that, their instinct says, go lay down, take a nap. And that's all they want to do. But chances are you might not wake up. So we want to really make sure that you are not using those types of gas-powered equipment inside. Always use it in a well-ventilated area. So speaking of needing gas, some tips: if you're going to need to use a generator or propane, we always encourage you to get those well before a storm. If you're using a generator, you might also consider getting a fresh pint of oil, because generators require oil. So if you haven't checked that in a while, now's a good time to do so. You also want to have cash on hand. If there are long duration power outages, chances are gas stations are also going to be out of power. So guess what runs on power? Debit and credit card machines. So if you can't use those because there's no power, how are you going to pay for your gas? They're not going to do an honor system. It's a business. They will require cash payment. And so it's always smart to keep a set amount aside just in case. And then the other side of this is food safety. Very, very important to monitor and be aware of your food that's refrigerator or freezer dependent. If your power's out for more than a couple hours, we sort of use the mantra, when in doubt, throw it out. So really want to make sure that you are not putting yourself at risk for developing a foodborne illness because you kept food that was stored improperly or at an improper temperature. So we also encourage you to check on your neighbors, especially those who are elderly or disabled. Make sure that they're okay, or better yet, invite them over and have them stay with you if you can. What's not on this slide, and I neglected to add this in here, Bloomfield does have public shelters available that they would stand up or activate in cases where there's large spread power outages. There's different types of centers that could be activated. One would be an overnight shelter, and that's where we saw those being activated during the severe weather storms that we had back in 2011, 2012 with hurricanes Irene and Sandy, or tropical storms, I should say. We had large swaths of towns without power for up to 2 weeks. So we definitely needed those shelters for people to be able to go to have some power, be able to power devices, be able to store medications, be able to sleep and feel safe in a protected area, especially when it's cold or hot outside. If there's no need for an overnight shelter, but there is need for charging centers, they might have a library open, they might have one of the fire departments open, they might have the senior center open just for that purpose, whether it's to charge your devices, to come in and cool off if it's a very hot day like we've been having, or in the winter if it's too cold, somewhere to warm yourself and stay during the daytime. But those are only open for set times. So we would encourage you to sign up for text alerts or other alerting systems by the town that would indicate when one of these shelters might get activated. And I'll give you that information towards the end of the presentation. All right, so trying to keep on track here time-wise. I'm not going to go much into this slide, but just to mention in my efforts to plan for emergencies, I need to plan for every person, regardless of what language they speak, whether they have special needs, if they're homebound, if they don't have insurance or they do. All of that stuff needs to be taken into account. And I have to plan for, we call it whole community. So basically, anybody and everybody. If you're a resident in my town, I need to make sure that you have what you need during an emergency, um, to the extent that it's possible. Um, a lot of what public health work is to do the greatest good for the greatest amount of people. And while we have much smaller numbers of people who, let's say, maybe are homebound or are electrically dependent, meaning that they have devices, medical devices that require electricity, that's such a small section of the population. If I spent most of my time planning for that tiny percent of the population, that would leave probably more than 99% of our population less prepared. And so there has to be a balance, between how we're planning and preparing for those different types of groups of people. So we really try to uh, push that personal preparedness. We try to do everything that we can to help keep our public and our residents safe and secure during an emergency. But you also have a responsibility to help in that. And we'll touch on what that looks like here in a minute. Just a couple of quick slides here on the need for volunteers. So our health department has 16 staff members. It ranges from several part-time staff to mostly full-time staff. And there's a lot of different jobs and a lot of different responsibilities. Most of the time when there's a public health emergency, we can't stop doing all of our regular work just because there's an emergency. But we also don't have enough staff to staff large-scale clinics, for example, for providing medications to the public in a rapid fashion. And so we do heavily rely on local volunteers and other regional or state volunteer groups to help us with that. So this slide just shows and highlights that need, that we don't have enough manpower and resources to do everything that we need to do and then also respond to an emergency. So there may be times like COVID where a public call goes out requesting volunteer services. And if that occurs, you'll be directed to a website or a phone number where you can, if you're interested, where you can submit your information and your name, and somebody will get back to you as soon as they can and determine whether or not your skills and abilities would align and match up with the jobs that are needed. So some volunteers might be able to help with like traffic flow, line throughput at like a mass vaccination clinic. It might be helping people fill out paperwork or translating for people. Viviani's been a wonderful asset to our health district. She speaks several different languages and has been, very tremendous and active in helping us identify other community source resources that can help us with that. So those are the types of things that we might look to community members to help with. All volunteers will receive specific training, and we call it just-in-time training. On the emergency, they'll be given briefings. They'll be told what their specific job is and who their supervisor is. So there's a very specific structure that we call and we follow, called the incident command system. And so there are definitely maybe opportunities for volunteerism with the health department. And if it's not directly with us, then we would encourage you to look at other organized groups like the Medical Reserve Corps, which is a regional group. And I can give you information on that. You don't have to be medical to be part of it. But it does, there are a lot of nurses, doctors, pharmacists, other healthcare professionals that are part of that group. But there's also people that are in admin or IT or other services that could help as well. And then there's something also called the CERT team. the Community Emergency Response Team. And those are more lay people trained specifically to help with maybe traffic management, working at a shelter, different community level events, or emergency type of events where individuals that don't have specific medical credentials can be utilized in a broader sense. So just touching on a couple of those, we can't do the work that we do in an emergency without volunteers. And so it is a very important role to play. All right, so talked a lot about preparedness. There's kind of a whole life cycle to it. And so if you think of, you see the image on the screen here of a circle. If you think of an emergency starting at the very top, you've got the incident that happens, then you have the immediate response. You might have some longer term activities that follow, but then there's got to be something called recovery. And how and what is recovery? What does it look like after an emergency? And it really does vary based on the kind of emergency that's occurred. Terrorism attack versus a severe weather event might look very different in terms of the speed of recovery, the type of resources that are required, the duration to which recovery will be completed. All of that is really dependent on that emergency type. In any recovery operation, we always have to collaborate with the community, with our healthcare partners, with our town and community service partners, and other community or faith-based organizations. Everybody has a role to play, just like they do in a response. Public education and communication is critical in any of these, throughout the duration of an emergency, but particularly so in recovery, because they need to understand that generally in an emergency, we're throwing a lot of added resources and manpower, all aimed at reducing the effects felt of an emergency. During recovery, so much of that added, infrastructure or resources are going to be reduced and pulled back so that we can start to transition back into somewhat of a normal operation or get back to our normal operations. And so we need to be able to communicate that with the public. So for example, when we are holding 2 to 3 public clinics a week to vaccinate partners and residents and anybody else that's in need of, medication, when we start to scale back on those emergencies, public needs to know so they don't just show up on a Wednesday when we had been holding weekly Wednesday clinics. So those are the sort of things that we need to consider and communicate for. And then obviously we have to monitor for any changes or need to scale back up any response activities if there's a spike in cases like we're seeing with COVID now, or if more resources are needed again. We have to be flexible to accommodate for those needs. All right, so on the personal preparedness side, we're almost done here. As I said, personal preparedness is very important, especially if you're going to be volunteering or working at the event. We can't rely on our staff and volunteers if they are not personally prepared, because if you don't know what you're going to do in an emergency, or you don't have the tools or resources you or your family need to be able to be self-sufficient for up to 72 hours or beyond, then we can't really count on you to come to work or come to that clinic to volunteer and help us, because you're going to be too consumed with thoughts on, oh my gosh, is my family okay? Are they safe? Do they have what they need? And so we really want to make sure that you know how to prepare for yourself and for your family. And it's simple. It's 3 steps. It's getting a kit, to making sure you have 3 days, at least 3 days of supplies for each family member. You want to make a plan. You need to develop a communications plan within your family members. So let's say you have to evacuate a particular area, but you and your spouse are working in different locations. One of you is out of town, the other maybe works in town. And then you have children who are at 2 or 3 different schools within the community, or perhaps somebody's even outside of your community in a different school system. How do you all communicate and say, okay, which one of us has to evacuate based on where the emergency is, and where are we going to go, and how do we all meet up? Similarly, if you have to shelter in place, you're not allowed to leave somewhere. Again, how do you know that all your family members know that? And when then can you reconvene as a family unit? And so those are the types of things that are important to consider as you're developing that plan. And then I think lastly, probably the more important piece of all of this is to be informed. You don't know what you don't know. And so if you are uninformed of an emergency or an event that is likely to occur, or that hasn't occurred yet but is on the horizon, that's your opportunity to have a little bit more of a direct impact on how well you're going to weather that emergency. The more informed you are, the better off you're going to be. And so that looks like monitoring news outlets, monitoring town-wide updates. So go to the town's website, go to the health district website, look at what the state is saying about whatever this emergency is. Go to those credible sources to learn about what's happening and what needs to be done by you as an individual, as well as departments or agencies within your jurisdiction or your community. Okay. So I'm going to go into a little bit on each of these. So having a kit, these are the types of things that we are encouraging you to have. So making copies of important IDs, documentation, deeds to the house, things that you need access to, any legal documents that you might need access to, make extra copies and keep them in a separate place that's safe, that you can grab and go, just in case you have to leave your house quickly and you don't know if your house is going to be there when you get back. Again, contact information. This day and age, everybody's lives live in your phone. If you don't have that backed up, or if you lose power and have no more juice to your battery, you're going to be dead. You're not going to have any of your contact information. So have it backed up on paper. Save that with your important documents. You want to have water, 1 gallon of water per day, per person, per pet. So that's a lot of water, right? So making sure that you have a lot of that on hand. Rotate that stock as well, because water jugs only last for a couple of months at a time before they start to degrade. So keep that in mind. You want to have non-perishable foods, first aid kits, any medications you might need. Make sure you've got extra on hand, enough for at least 3 to 7 days of medication is what I recommend. We talked about the importance of flashlights, radios, batteries, cash, any other personal hygiene needs, and then clothing. And it should be weather dependent clothing. So the type of season that you're in, making sure you've got closed-toed shoes available, or a pair of boots is ideal. Gloves, like work gloves. And then one other big piece, since we're talking power outages earlier, if you're going to be without power, if you're relying on canned goods, make sure that you have a manual can opener. So many people forget that and can't open the food because they don't have something to open it with. And it's always a good idea to have a smaller version of these kits for your car and add in some other winter specific items as well, such as like blankets, those space blankets, those light sticks that you can break and it turns into like a chemical light. All those are really important to have and keep in your cars as well. Might also want to keep a small shovel and like a couple of baggies of like cat litter or gravel or dirt or something, in case you ever get stuck in a ditch and it's winter with snow or ice on the ground. You can use that as traction for your tires. Okay, so making a plan. These are just the steps and what to include in that plan. So we talked about communications plan, create a specific shelter in place plan, and include an evacuation plan as well. And then know your emergency plans for work and school, and make sure that everybody in the family knows what you're going to do in each of those events and how to get in contact with one another during that time. And additional, if you have to evacuate outside of your area, generally, because Connecticut's so small, like for a severe storm, we might say, it might be encouraged to evacuate outside of the state. So if you have friends or family in another state like Massachusetts or New York or something, it would be good to make sure to have those individuals' phone numbers printed and set off aside so that you can easily contact them and ask if you can stay with them. And then the last part here is having that emergency plan. So again, determining where you're going to meet in that in an event of an emergency. So our first location should be home, second should be relative or friend nearby, like I said. And then that third is, outside of the immediate area. So keep those in mind. All right, so skip that one. Other ways to stay informed. We talked a bit about this already, but the weather radio, emergency alert systems are helpful. Any other like TV or media broadcasts are extremely helpful. And then this is what's in red here. These are active website links that you can click on to enroll in Bloomfield's. They use a service called Code Red, which is an automated telephone notifications service that sends out widespread information about a particular emergency or event that's happening. So that's a really important thing to gain access to. So we've got West Hartford and Bloomfield if you wanted both. And then there's also a link for the Connecticut Alert System, which is another statewide alerting system. So general home safety, what to do in a power outage, look for water and utility shutoffs, make sure you've got smoke and carbon monoxide detectors and the batteries are current, change those every 6 months. And so this is kind of the recap. Be aware, plan, and prepare. There's lots and lots of resources. This is one of them, Get Ready Capital Region. There's another called www.ready.gov. They have a ton of resources for preparedness in so many categories. So I definitely encourage you to check those out. And then in addition, in the health department, we have lots of resources in print. So if you're ever just looking for some more information, feel free to come down to the office. You can speak to myself if I'm there, or somebody else in the office can help you. But that's it. So I gave you guys like 3 minutes of time to ask me questions. So I'm going to stop sharing and allow you guys to ask away for the next couple of minutes.